everyone, my name is Denise Amaro. Okay, we're going to be discussing standard and transmission-based precaution, also known as isolation precautions. And you ask why you want to know. Well, it helps the spread of infectious diseases to patients, other patients, yourself, myself, and other hospital staff members. Okay, we're going to be discussing your personal protective equipment, also known as PPE, that you'll be wearing for the standard precautions. We'll also be discussing about the different types of isolation precautions and what precautions you have to take to prevent the spread of infection. Okay, the first thing we're going to be talking about is standard precautions. Those standard precautions are always wash your hands, good hand hygiene. You want to wash your hands with soap and water when entering a patient's room. After that, you want to place some gloves. That way, if you come in contact with your patient with any body fluids or anything, you'll have your hands protected with gloves. Okay, once you exit the patient's room, before exiting, you always want to take off your gloves while you're still in the patient's room. You never want to leave the patient's room with the gloves still on. Okay, and after doing that, you can use either some hand sanitizer or you can use hand hygiene with soap and water as regular. Okay, some situations you might want to use your PPE is whenever you're dealing with blood, body fluids, non-intact skin, mucous membranes, secretions, fluids, whatever that is, and your PPE is going to consist of some gloves, a gown, and protective eyewear, okay? Alrighty. Now we're going to discuss the different types of isolation, okay? When you have transmission-based precautions, they require some extra steps to follow for illnesses that are caused by germs. There's 3 types of transmission-based precautions, and the first one we're going to talk about is contact precautions. Okay, and you're going to have a sign. You're going to have a sign outside of your door, and it's going to look something like this. And with contact precautions, usually you have patients who have C. diff, MRSA, VRE, some of those infections that they carry. And so in addition to your standard precautions, you want to wear a gown and gloves upon entry into the patient's room. If I could have a member from the audience, please. Right here. Okay. Alrighty. And so first thing we're going to use is a gown. You always want to use a gown because with these infections, C. diff, MRSA, and VRE, these are really infectious diseases that are in your digestive tract, respiratory. It can be in any of your systems, okay? So we're always going to have this gown on, okay? All right, this is what it looks like. You're going to put it over your head, and you're going to put your arms in here, okay? Now, you want to tie this up, so you're going to tie it from the back, and then if you want to turn it back around. And then you want to tie it from the front. That way it is securely on you. Okay, there we go. And once you have that on, you want to place some gloves on as well because you will be in contact with your patient. Okay? So if you want to place those gloves on, that would be good. You also have a thumb holder right here. Alrighty, there we go. She's nice and safe, and this is going to keep her, it's going to prevent her if you're dealing with any urine or feces or body fluids such as blood or anything. If it splashes on you, you're going to be protected. Even though you have scrubs, you're still going to be protected with that. You also can wear masks. There's 2 different types of masks you can wear. So you want to put a mask on. That way, if anything splashes into your mouth or anything, you'll be protected from that as well. Alrighty. Alrighty, so that is what our PPE looks like. Our healthcare worker is going to look like with this equipment on. She's going to have it on before she enters a patient's room. Okay, now when exiting a patient's room, she's going to take all of this stuff off before she exits the room. Okay, so when you take this stuff off, the first thing you want to touch is the least equipment that is suspected of germs. So it's going to be your mask. So you're going to take off your mask first. Okay, you're going to throw it in the trash. Of course, there's a trash can. Yeah. Okay, now when you take off your gown, you want to pull that. Okay, and then you want to grab from here, the outside of your gown, and pull one sleeve off. There you go. And keep that sleeve and kind of wrap it around. Okay, there you go. And then we're going to help her out a little bit here. Okay, and then we're going to roll it. Okay, there we go. There you go, and then you're going to grab this glove and put the glove over it. That way you're not touching, so that way if there's any substances on you, you can have it, you won't be touching it, okay? Alrighty, and so that's for our contact precautions. You always want to be fully gowned because this infection is serious, so if it gets on your skin, it can, easily be transmitted that way. Alrighty, thank you very much. You can take a seat. Okay, our next one we're going to be talking about is our droplet precautions, okay? These are used to prevent contact with mucus and other secretions from the respiratory system. Okay. When a patient talks, sneezes, or coughs, droplets contain contagious germs. Some illnesses that require droplet precautions include influenza, pertussis, and mumps. So anyone entering upon the room should wear a surgical mask. So here's our surgical mask right here. And you'll just place it on your ears, put it above your nose, and pinch the tip of the nose. Okay, and that way nothing gets in. Alrighty. Alright, the next one we're going to be talking about is airborne precautions, okay? Airborne precautions are for germs that are so small that they can travel within 3 feet in the air, and these precautions protect anyone from entering the room from breathing these germs. Some sicknesses are chicken pox, measles, and tuberculosis, okay? So patients are placed in a negative pressure room. This room is used to suck out the air. When you open the door, it sucks in the air into the room. That way nothing leaves out of the room, which is good for everyone else. It's a great way to prevent the spread of tuberculosis or measles. Okay, so everyone who enters the room should put on a respirator mask, which could be like an N95, and make sure it fits well before entering. Okay, so these precautions, you want to take them to help prevent the spread of germs and infectious diseases, so you should always be careful. When these signs are posted on the patient's door, you always want to pay close attention to them and see what personal protective equipment you'll need to enter the patient's room, okay? Any questions?
Yes.
Yes,
Are
sir.
there enough gowns for visitors?
Yes, sir. There are enough gowns for visitors. We always keep a container outside of a patient's room with the bin. We have gowns, gloves, your mask, and you always want to pay attention. You'll see it on the door. There's that container, and it's always stocked and filled, ready to use. Any other questions?
About how long do patients stay in isolation rooms?
It usually depends if the infection has been cleansed out of their system or something. So until noted by a physician or a doctor, then that's until it is. But it'll be charted, and all the stuff, the precautions, the signs will be taken down from the door. Any other questions? No? Alrighty, well thank you for your time. Remember, you want to isolate the germ, not the patient, and remember, infection prevention is in your hands. Alrighty, thank you very much.